Good morning. I'm Mrs. Conlon, and I'm here to do the Oral Med Pass Competency here at Stautzenberger Mommy Campus. So, welcome. I'm going to ask that you take out your competency check sheet and follow along as I go through it. Remember, if I say it out loud, you need to say it out loud. Things in bold are required to pass the competency. It means you have to state your 6 rights 3 times during your med pass to pass. Your competency, you must check the patient's allergies and make sure you're not giving them something they're allergic to, okay? And you always have to check that you're giving it to the right patient. So you must verify their armband, their birthday, something like that, okay? So I'm not going to use this, but you are. So I'm going to start the competency as all competencies start is that student is in uniform. So starts out with the 6 rights: right patient, right drug, right dose, right route, right time, and right documentation. 4 considerations: does this drug match my patient's diagnosis? Is there a drug-to-drug interaction? What is my patient's height and weight, and what is their vital signs? So then I'm going to go into my CG wipes. I'm going to check orders. This is a very important part of a nurse's job. So what you're doing is you're checking your order sheet against your MAR to make sure that they match, okay? So I'm checking Terrence Walker, 7621, 7621. Patient's birthday is 10/21/87, 10/21/87. The patient is allergic to penicillin, and here, allergic to penicillin. Now I'm going to come down to the medicines. Disregard that I've used this already. So metoprolol, 100 milligrams, 100 milligrams, by mouth, twice daily. And this tells me why. For hypertension, that's high blood pressure. So it says hold if systolic blood pressure is below 100 and or pulse is below 60. So I can ask my instructor right now, what are my vital signs? 120/80, pulse is 70. So I would be okay to give these meds. Then the next medication is simvastatin. And I'm checking it here, simvastatin, 20 milligrams, by mouth, daily at bedtime. This is for hyperlipidemia. That means elevated fats in the blood. So I no longer need my order sheet or meds are reconciled. So next, so I just put that aside. Next, I'm going to check policy and procedure. Am I allowed to pass these medications? Yes, I am. So gather supplies, which for this would be hand sanitizer, med cups, my med cart, and gloves, and labels. So, and then I'm going to wash into my patient's room. Knock, 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 washing in. Hi, I'm Miss Kathy. I'm your registered nurse for today. First name and title. Can you tell me your name and your date of birth? Your name is Terrence Walker. I'm checking the armband. And I'm checking it against this. And what's your birthday? October 21st, 1987. I look and see October 21st, 1987. That's correct. I see you have a red allergy band on. Can you tell me what you're allergic to? You're allergic to penicillin. That matches the sheet. And what happens when you take penicillin? You get a rash. Okay, so we won't give you penicillin today. So I have checked orders, gathered supplies, washed in, identified myself, 2 identifiers from a patient. I'm going to provide privacy by pulling the curtain, explaining the procedure that I'm here to give you 2 medications. One's for your blood pressure, which we check your vital signs and it's appropriate to give it. And one's for your cholesterol. It's a cholesterol type of lowering medicine. Have you had these medicines before? You have. Have you had any difficulty with them? No? Good. And then, so I've explained the procedure, and now I'm going to provide safety. The bed is in the lowest position, the side rails are down per policy, and the call light is in reach. And I'll be right back with your medicines, okay? So I'm going to wash out. I come back to my med cart. And I'm going to go ahead and open the drawer and get out the medicines I need. Okay, so I'm actually looking for Terrence Walker, and I'm getting out the metoprolol and the simvastatin. This is where I do my first check. So my first check is I'm checking the bottle against the MAR. So I have Terrence Walker, 7621, 7621, metoprolol, 100 milligrams, 100 milligrams. It's by mouth. This is a tablet, so that's an appropriate route. This says twice daily, and so the time is now, and I'll document at the end. Now, for my next medicine, I'll go through the 6 rights again. Terrence Walker, 7621, 7621. Simvastatin, 20 milligrams, 20 milligrams. It's a tablet, and this says PO, so that's an appropriate route. And the time is now, and at 2200, and I'll document at the end. So first check is done. I move the one rubber band over. Okay. Now I'm going to prepare my medications. I encourage you to always wear gloves. You do not want to get medications on your hands. You can become drug resistant, and if you get sick, you might need that drug to work. Okay. So when we dispense these medications, we always pour the capsule or the tablet into the lid. Okay. Sort of sticking, I apologize. So I'm going to dispense 1 metoprolol into the lid, just very gently. The reason we do it into the lid is if we pour out more than 1, I can easily pour it back into the bottle. It has not been contaminated. Okay. And then simvastatin. Again, I'm going to dispense 1 tablet into the med cup. And I keep my medicines right by the med cups. Okay, I'm actually gonna take off my gloves and make my labels. Always the students ask me what goes on the labels. I put the patient's initials, the last 4 of his MRN number, and then I'm going to write the medicines down. Metoprolol, 100 milligrams, PO. I put the route so that if it becomes a sublingual, it might look the same, but it's meant to be under the tongue or something like that. So simvastatin, that's 20 milligrams, and that's PO. So now I'm going to go ahead and put my labels on my med cups. I'm going to do my second check. So second check is after your medications have been prepared. Okay. So I'm going to take my medicine and my med cup and compare these to my MAR. So I have Terrence Walker, 7621, 7621, 7621. I have metoprolol. I have 100 milligrams, 100 milligrams, and 100 milligrams. It's PO, it's a tablet, that's appropriate, and the time is now, and I'll document at the end. Second check for that medicine is done. So now I'm going to do second check for simvastatin. Start at the top, Terrence Walker, 7621, 7621, 7621. I have simvastatin. I have 20 milligrams, 20 milligrams, 20 milligrams, and it's by mouth, and this is a tablet. That's appropriate, and I've labeled this PO, so that's appropriate. And the time is now, and I'll document at the end. Second check is done. Okay. So I'm going to put my medicines away into the correct drawer. And then I'm going to take my medicine and some gloves to the bedside and my MAR. Okay. These three things go with me. Okay. Most patients will have gloves for you at the bedside. So, okay. So sorry about that. It's weird doing it all. So I'm going to knock, wash in. Hello. Hang on, let me bring my camera around. Hello, can you tell me your name again? It's Miss Kathy back with your medicines, your registered nurse. Hey, you're Terrence Walker. Yes, confirming it on your armband, Terrence Walker. And your birthday, 10/21/87, 10/21/87. Actually, very good. I am here to pass the medicines we talked about, your metoprolol, which is for your blood pressure, and your simvastatin, which is for your cholesterol lowering medicine. Did you think of any questions? No? Okay, I'm going to do my third safety check now. Oh, I forgot to verify your allergy is penicillin, and it is penicillin. These are not a penicillin drug. Okay, we won't give you penicillin. So, now I'm going to do my third check at the bedside. Now I've identified my patient. Okay, so I'm checking my med cup against my MAR. So it's Terrence Walker on the cup, TW, Terrence Walker on the MAR, 7621, 7621, 7621. It is metoprolol, 100 milligrams by mouth. It's a pill, so that's appropriate. And the time is now, and I'll document at the end. And then I have second med, Terrence Walker, 7621, 7621. I have simvastatin, 20 milligrams by mouth. It is a pill, so that is appropriate. And the time is now, and I'll document at the end. Third check is done. Okay. I'm going to raise the head of your bed a little bit. Oops, sorry, to a semi-Fowler's position. So you don't choke. Do you have any difficulty swallowing? No? Okay. I don't have a glass, so I'm just going to pretend a glass. Okay, I'm going to give you a sip of water to wet your whistle. Really what I'm doing is evaluating the patient's ability to swallow. And it doesn't hurt to wet the whistle. Okay, I'm going to give you your blood pressure medicine first. Okay, so passing that, not really putting it in the mannequin. Give a sip of water. After they swallow, check their mouth to make sure it hasn't lodged in the cheek or under the tongue. And then again, I'm going to give the simvastatin, followed by a sip of water. Now I'm going to ask the patient to say, make sure that it has not lodged under the tongue or anything. And I forgot to put on my gloves when I was dispensing my meds, so I apologize. And then, so I'm putting the patient in a safe position, bed down, call light and reach. And I remind the patient, do not get out of bed without putting on your call light, as the blood pressure medicine can make you a little dizzy, okay, when you change positions quickly. So now I'm going to return to my cart and chart my medicines. I'll be back to check on you in 20 minutes. Okay, so I come back to my cart and I'm charting my medicines. Students always want to know, how do you chart it? You put a slash through the medicine and a slash through the medicine and your initials and your initials. And then down here, your signature and your initials. Okay, so now 20 minutes has passed. I'm going to go back in. Question. Hi, Mr. Walker, how are you doing? It's Miss Kathy checking in on you after your med pass. You're doing well. Okay. Did you have any questions? No? You know to put on your call light if you get up? Excellent. Okay. I'm going to put you in a position of comfort and enjoy the rest of your evening. And then I'm going to wash out. Wash out. And then my competency is done. So that's it.